A series of short videos on leaky gut syndrome and dysfunctions with the stomach and the intestines. And this could be under the umbrella of other things too, like irritable bowel syndrome, Crohn's disease, colitis, various things. Anything that just seems to be wrong with the digestive tract. And what type of tests can you run? You can do some blood tests, you can do some stool tests, you can do some hair analysis. Each one of these tests has different strengths. For identifying if you have some food sensitivities, you can do testing with blood. You can do some testing with a skin scratch test. There's various tests that can be run. I like to do a finger prick test to get a couple of drops of blood from the finger on some paper, send it into the laboratory, get some results back in about a week, and that can tell you what foods you're allergic to. You can also do some testing with applied kinesiology type testing. Skin scratch testing, I think, is a weak type of test. But those are different things that you can do for identifying food sensitivities or allergies. Low-grade infections, I think, should be tested for with a stool analysis or applied kinesiology. But it's very rare to hear that someone had a stool analysis exam done, where a stool sample is sent to a laboratory, you get the results back. That would be a great way to get an idea what's going on with low-grade infections in the intestines. For toxins in the body, generally toxins accumulate, and then you can find out if the toxins are in the hair. So a hair sample sent off to a laboratory can identify if there's some toxins. And then if you have some nutritional deficiencies, that will also show up long-term in the hair sample analysis. You can also do a blood test or some applied kinesiology testing for these various things. So there's various tools for how to test for these problems. And I just don't think that some of these simple, inexpensive tests are ordered enough that can identify some of the root causes. So various tests can be ordered, and I just find that they're not ordered enough, that you haven't identified what's the cause of the problem, so the cause is still there, problem's going to still be there. And then that often leads to, hey, this is not getting fixed, and so people reach for something that just numbs the pain or calms down the symptoms. So some prescription drugs, over-the-counter medicines that calm down pain or what have you, kind of masking the symptom because it's not getting better. So you need to find out what's really at the cause of it and handle the cause, and then symptoms clear up. So these are just some of the tests I wanted to talk about that can be ordered to identify what the causes of these things are. If you know someone with some stomach problems, leaky gut, Crohn's disease, colitis, irritable bowel syndrome, mystery, my stomach has troubles, share this video with them, please. And ask questions. If you have any questions, please comment below. If you'd like to hear me do a little video or answer a question on some subject, please comment. I will do my best to answer your question or make a video about it. Thanks a lot.